Started. So today I'm going to talk about an old age saying, health is wealth. I think almost everyone have know why health is considered so important, but today I'm going to talk a little bit about, do we really know that? Now, if we if we talk about wealth, we know that how much wealth do we have. We know that, how much money do we have in our bank accounts. We know that where to get it. We know, what are the various ways, like the TMI, there are a lot of different schemes, you keep hearing about it, insurance, so we know a lot about wealth and how important it is for us. But when I talk about health, then do we know how healthy we are right now? Right? We know that where to go ahead and get it fixed if we know where the problem is or what the problem is. So I'm going to talk a little bit about that. What is the current gap in the entire health system in the world today? Now, just to tell you an extent of the impact of the problem, every 6 seconds in India, someone dies out of heart attack. Every 6 seconds. Now, if you pick up any day's newspaper, you'll find that someone or the other, some VIP actually died out of heart attack, right? So that's the kind of problem which we are talking about. But unfortunately, this number is actually, decreasing. More and more people are dying out of diseases like heart attack than ever before. A little bit more about death. I'm sorry, that's not the best thing to talk about, but it's important for people to be afraid of. Then that's the one thing which has worked the most. Now, if you talk about the communicable diseases like be it Nipah, Ebola, common cold, which people can transmit from one another, there are approximately 1/3 of all the deaths are because of these diseases. But it's the best part about these diseases are that people know exactly when they are having it. They're coughing, there'll be fever, they'll not feel good, and they can't go to work. So effectively what they'll do is they go to a doctor, they take medicine, and they'll keep taking until they can actually go back to the work and live a daily life. But 2/3 of all the deaths today in India is because of non-communicable disease, like diabetes, hypertension, and other cardiovascular diseases, right? Now, what is the worst part about these diseases are that most of the time they're absolutely asymptomatic. What effectively means that you have absolutely no symptoms. The worst is, even if you know, someone tells you that, hey, something is wrong, most of the times you don't go to the doctor for the next level of care. And this is one work which we did, which is like we screened 10,000 people. Out of that, we found close to 39% people to be actually having one or the other of the non-communicable diseases I talked about. And within that, after a month, we saw that only 11% of them went to the doctor. 89% didn't even bother to go to the doctor. And effectively, that is causing the problem which I talked about, which is 6 seconds every someone is dying out of these things like a heart attack. Now at least thankfully we have an option where we have the details, phone number, and addresses of these people whom we can go ahead and constantly motivate and prod to actually go and take more care. Now, what's the cost of chronic disease? Why is it important? One is, of course, I think from all the numbers which I said, we individually are not absolutely disciplined for taking better care of it. So now, what exactly is the cost? Why everyone else should bother about it? Why the society? What does it mean for the society? So the chronic disease is like there will be some symptoms now and then. There will be some symptoms. Usually, it's found out when we have gone for some other, gone to the doctor for something else, and then you find, hey, there is actually something wrong, and we need to start taking medication. But the moment again you take medicine, you feel better, and after some time you again just drop out of the medication. So over a period of time, the disease keeps growing inside while you feel absolutely nothing about it. And the worst is it makes you disable. You don't feel so energetic to actually work. So you don't only die prematurely, but you also are made disabled from the work a lot earlier than what you would do otherwise. So effective loss is actually 4 to 6% of GDP, which I convert for like a country, large country like India, is like close to 10,000 crores. I mean, so there's a lot of zeros after one in terms of rupees. Now, why is it so difficult? Why is it so difficult? Now, approximately 14 million premature deaths can be saved every year. 14 million, 1.4 crore deaths can be saved every year. If only we can manage the things like very basic body parameters like blood pressure and blood sugar in time. It's as simple as that. There are a lot of devices out there. There are a lot of suggestions out there, be it diet and everything. We just need to follow it. But then why? More and more people are actually dying year over year. Now, once you go deeper, is it the medication? Actually, no. The medication for diabetes has been available for more than 20-30 years. What about hypertension, which is like prime? For hypertension also, the medication has been available for last 20-30 years. But then still more and more, except Africa, in all other developing countries, in all other regions, more and more people are dying out of so-called non-communicable or chronic diseases than anything else. When we get deeper into it, we figured that it's a problem on two ends. One is we individuals, by human race, are not designed to be so disciplined. That's one. And the second is also the current health system doesn't help you. The current health system is reactive, which means that if you have a pain today, I think the health science has developed so much that you can get the fix in pretty much every hospital over here, right? But the moment you come out of the hospital, what next? Then it is completely left to you again to figure out that what you should be doing. There is absolutely no support. And from the data which we saw, the problem is growing and growing every year. So we need to have a systematic fix over there. If you see that today's the entire health ecosystem, if you see on the right hand side, there is acute care. So again, like I said, if there is a problem, if you know that there is a problem, you can get the best fix out there. And I think the entire health ecosystem is designed in a way that you can actually get the best care. There's a lot of efforts towards the wellness side of it, which is a diet. Like a lot of devices have come up where you can measure, your steps, burn calories and so on, and that also helps a lot. But there is a huge gap, or I would say the care is very fragmented in the center, which is like what is called as a primary care or disease management. Like many of the people don't even know what is disease management. Things like chronic diseases, you can't get rid of them. The only thing what you can do is to actually manage them, to keep it in control. So what we need to do is get this problem. We need to figure out a way to fix this problem. Now, why me or why us? So I couldn't come to CBIT, so I had to go to IT Bombay. So so I did my undergrad from IT Bombay, and after that I worked for an organization called I2, which was later taken over with JDA, and I learned that how can we make the business process more and more efficient. And then I was interested in healthcare, so I went to ISB to study, do my healthcare management. While I was there, just like there's so many competition, I participated in something called Health Prize, and we'll run a quick video of that.
I love the Health Prize. You, in so many ways, represent the future. The Health Prize is about more even than the solution to the problem advanced. It's about how the world has to work in the 21st century.
Sometimes these ideas that they sound a little out there at first blush, but then you realize that there's actually quite a bit of substance behind it. It's the youth and not the leaders of tomorrow, the leaders of today, and I think these are the people who will be able to show us what the future really is about. There is a sense of citizenship, and there's a sense of actually acting on your presence and existence in your community.
You've heard all of the entrepreneurs in the NGO space say that charity is not enough. Well, if charity is not enough, then what is? It's business. And that's why I'm so pleased today to tell you about 6 great teams.
Decay affects 2.4 billion people. Xylitol gum intervened in this process. We, Harambee Vision, believe we can change all of this by locally manufacturing and distributing eyeglasses in urban slums.
This significantly improves the quality of life life of every patient with a wound. Using bees to screen for diseases in urban slums. The REACH program, the first and only diabetes monitoring program for urban slum dwellers.
The journey of NanoHealth, a social enterprise that aspires to right-size healthcare for urban slum dwellers, bringing cost-effective healthcare right to the doorstep. We believe we have come up with a good solution which can be implemented.
Judges, we'd like to ask you to make your way backstage. Audience, we'll be back with a few closing remarks, and we'll do the presentation of the 2014 Hall Prize.
Judges have selected NanoHealth in the Indian School of Business.
Thank you. So that was like 4 years before. I still get goosebumps every time I see it, and we were the first Indian team to actually get into the finals and actually win it. If you don't know about what HALT Prize is the largest student social entrepreneurship competition worldwide. It's a year-long process. It's also called the Nobel Prize for students. Check it out, and you should definitely be a part of it. So all the entire student community is part of it. Now, basically, that was the problem, and then that gave us a big boost to actually go after the solution for this huge problem which we are talking about. Now, the solution what we have been able to figure out is like keeping the patient in the center of the entire health ecosystem. We have been able to actually link all of them together. We have been able to at first get people to understand that there is there is a disease which they have, and still you don't need to worry about it. Make it very, very convenient for them to actually address that, and then most importantly, make sure that there is a connectivity which is from each event to other event to other event, right? So for example, it's not only if I'm identified with something for the first time and you just figure it out yourself. I mean, it's very, very tough for anyone to go to a doctor, spend half a day, one day, and go to a doctor for something which you don't even think that there is a problem. So we have tried to make it proactive, very convenient, and connected. How we have been able to do it, it's also that for something which is like a long term, it's we also believe that only if you keep sending notifications on an apps, that's not enough. For some, there is an empathy which is required, there is a human touch which is required. So we have been able to merge both the technology and so what is called as a human touch to ensure that this continuity of care is maintained. Now, there is more to it. So we really believe that if you want to know that you're totally healthy, just like you want to know that how much money is in my bank account, then there are 4 different aspects of health: fitness, diet, physical health, and mental health. And then only when you are able to actually capture and manage all of it together, that's the only and only way in which you can be absolutely confident that you are healthy. So Mr. Total Health has his entire, health history on his phone, right? He can share it with his other doctors and whoever he wants to, and take feedback and suggestions from his phone, right? He wants to he continuously get recommendations for be it his refill of the medication, be it his annual health checkup, or the timely diagnostics. So by doing all of this together, we have been able to actually make the health system as a whole a lot more efficient and effective, and that directly adds to a lot more wealth. It means that the people are taking a lot less sick leaves. It means it's great for the individual themselves because they're a lot more healthier. It also means that for the organization, for the large organization, it's people are a lot more efficient and effective. So My simple question is, how many of you do you really know that are you Mr. or Mrs. Total Health? Thank you.